Medical nutrition therapy for diabetes. Do you know you can control diabetes through diet? This can be done by the medical nutrition therapy, MNT. Medical nutrition therapy, MNT, is an evidence-based approach to treating and managing medical conditions using individualized nutrition plans. MNT is an important component of diabetes management and can help patients achieve optimal blood sugar control, reduce the risk of complications, and improve overall health. The main goal of MNT for diabetes is to balance blood glucose levels by regulating the intake of carbohydrates, fats, and proteins. This can be achieved through various approaches, such as carbohydrate counting, glycemic index, and Mediterranean diet. MNT for diabetes also involves educating patients on healthy food choices, portion sizes, and the importance of regular physical activity. Working with a registered dietitian is key to developing an individualized nutrition plan that takes into account a patient's specific health needs, preferences, and lifestyle. Medical nutrition therapy, MNT, is a broad category of interventions that use nutrition to prevent and manage medical conditions. Depending on the severity of the condition, MNT can be classified into different levels of prevention: primary, secondary, and tertiary. Primary preventive MNT focuses on preventing the development of medical conditions before they occur. This approach may involve promoting healthy dietary patterns and encouraging physical activity to prevent conditions like type 2 diabetes or heart disease. One example of primary preventive MNT is the Mediterranean diet, which has been shown to reduce the risk of developing type 2 diabetes, cardiovascular disease, and certain cancers. Secondary preventive MNT aims to prevent the progression of a medical condition that has already been diagnosed. For example, in patients with diabetes, secondary preventive MNT may involve monitoring and adjusting carbohydrate intake to manage blood glucose levels and prevent the onset of complications. Carbohydrate counting is a common type of secondary preventive MNT for diabetes, which involves tracking the amount of carbohydrates consumed in meals and adjusting insulin doses accordingly. Tertiary preventive MNT focuses on managing the complications of a medical condition after they have occurred. For example, in patients with kidney disease, tertiary preventive MNT may involve reducing protein intake to slow the progression of kidney damage. Similarly, in patients with diabetes-related neuropathy, tertiary preventive MNT may involve supplementing with specific nutrients to manage symptoms. Numerous studies have shown that medical nutrition therapy, MNT, can have significant benefits for individuals with diabetes. For example, one study published in the Journal of the Academy of Nutrition and Dietetics found that MNT can help improve blood glucose control, reduce the need for medication, and improve overall quality of life in patients with type 2 diabetes. Another study published in Diabetes Care showed that MNT can lead to significant weight loss in overweight or obese individuals with type 2 diabetes. The study found that participants who received MNT lost more weight compared to those who received standard diabetes education, suggesting that MNT can be an effective tool for weight management in this population. In addition to blood glucose control and weight loss, MNT has also been shown to have positive effects on cardiovascular health in individuals with diabetes. A meta-analysis published in the Journal of the American College of Cardiology found that MNT can lead to improvements in several cardiovascular risk factors, including blood pressure, cholesterol levels, and inflammation. Overall, these studies provide strong evidence that MNT can play an important role in the management of diabetes. By working with a registered dietitian and incorporating evidence-based MNT approaches into their lifestyle, individuals with diabetes can improve their health outcomes and reduce the risk of complications. When it comes to managing diabetes through nutrition, diet plays a crucial role. A well-planned, individualized meal plan can help individuals with diabetes manage their blood glucose levels, maintain a healthy weight, and reduce the risk of complications. One key aspect of a diabetes-friendly diet is carbohydrate management. Carbohydrates are the nutrient that has the biggest impact on blood glucose levels, so it's important to monitor and control carbohydrate intake. The amount of carbohydrates a diabetic patient should consume can vary depending on factors such as age, activity level, and medication use. However, a general guideline is to aim for 45 to 60 grams of carbohydrates per meal. In addition to carbohydrate management, it's also important to pay attention to fats and proteins in the diet. Diabetic patients should aim to consume healthy fats such as olive oil, avocados, and nuts, while limiting saturated and trans fats. Protein intake should be adequate to support muscle mass, but not excessive, as excessive protein intake can increase the workload on the kidneys. Aside from macronutrients, it's also important to ensure that diabetic patients are getting enough fiber, vitamins, and minerals. Foods such as fruits, vegetables, whole grains, and lean proteins can provide a good balance of these nutrients. To ensure that diabetic patients are getting the right balance of nutrients, it's recommended to work with a registered dietitian to develop an individualized meal plan. A registered dietitian can help tailor meal plans to the patient's specific needs and preferences, and can also provide guidance on monitoring blood glucose levels and making adjustments as needed. Overall, a well-planned, individualized meal plan that focuses on carbohydrate management, healthy fats and proteins, and adequate fiber, vitamins, and minerals can play a key role in the management of diabetes through nutrition. By working with a registered dietitian and following evidence-based recommendations, individuals with diabetes can optimize their health outcomes and reduce the risk of complications. When it comes to meal planning for diabetes, it's important to focus on whole, nutrient-dense foods and to balance carbohydrates, proteins, and healthy fats. Here are some examples of diabetic-friendly meals. For breakfast, a good option could be a bowl of oatmeal with chopped nuts, berries, and a sprinkle of cinnamon. This provides a good balance of carbohydrates, protein, and healthy fats, and the fiber in the oats helps to slow down the absorption of carbohydrates. For lunch, a salad with leafy greens, grilled chicken, avocado, and a drizzle of olive oil and vinegar can be a satisfying and balanced option. Adding some legumes such as chickpeas or black beans can also increase the fiber and protein content of the meal. For dinner, grilled salmon with roasted vegetables and a side of quinoa can provide a good balance of protein, healthy fats, and complex carbohydrates. The salmon provides omega-3 fatty acids, which have been shown to have benefits for cardiovascular health, while the vegetables and quinoa provide fiber and other important nutrients. For snacks, options such as a small piece of fruit with nut butter, hummus with raw vegetables, or a handful of mixed nuts and seeds can provide a good balance of carbohydrates, protein, and healthy fats. When dining out, it's important to look for options that are based on whole, nutrient-dense foods, and to pay attention to portion sizes. For example, choosing a grilled chicken salad with a side of vegetables, rather than a burger and fries, can provide a more balanced and nutrient-dense meal. Overall, by focusing on whole, nutrient-dense foods and balancing carbohydrates, proteins, and healthy fats, individuals with diabetes can enjoy a wide variety of satisfying and delicious meals that support their health and well-being. Overall, MNT is an effective and essential component of diabetes management that can help patients achieve better blood glucose control and improve overall health outcomes. By focusing on individualized nutrition plans, MNT can provide patients with the tools they need to take control of their health and manage their diabetes effectively. Thanks for watching.